Welcome, everyone. And we are so excited that you are here for the Gift of Health Total Tuesday Wellness. And for those of you who are meeting us for the very first time, welcome, everyone. And we are so excited that you are here for the Gift of Health Total Tuesday Wellness. And yeah. For those of you who are meeting us for the first time, I'm Dr. Shobha Rayapudi. I'm the co-founder of Gift of Health, where we help people struggling with chronic diseases, including but not limited to high blood pressure, high cholesterol, diabetes, arthritis, heart disease, and gut disease, to break free from these diseases, reduce the dependency on medications, and have more energy. And today's session is going to be mind blowing because I have an esteemed guest speaker, which I'm very excited about. So let me introduce you to Dr. Neha Bhanusali. And it's such a huge honor that she is here with us today. So Dr. Neha Bhanusali is a triple board certified in internal medicine, rheumatology, and lifestyle medicine. And she currently is acting as an associate professor at the UCF College of Medicine in Florida. She is an integrative rheumatologist with expertise in diagnosing and treating autoimmune diseases like gout, rheumatoid arthritis, lupus, and psoriatic arthritis. So she focuses on personalized, patient centered care, exploring how diet, exercise, stress, and lifestyle affect inflammation. So she typically blends this Western and complementary therapies to provide a holistic approach to patient care. She's also an active member of the American College of Rheumatology and has participated in global health initiatives as a medical volunteer. You can find her on YouTube and Instagram handle, which is at PlanForwardMD. And without further ado, I would love to welcome Dr. Neha Bhanusali. So welcome, Neha, and thank you for joining us today.
Okay. Hi, how are you doing? Can you hear me okay?
Yes, we can hear
Okay.
you.
All
Yes.
right. Well, yes, thank you for having me. And I'm always excited to talk about arthritis and all of the rheumatic conditions out there, which I think are a little tougher to understand sometimes because they're not as maybe well studied or in the media, and people don't quite know what to do with them. And yet it is extremely common all around us
Uh-huh.
and sometimes hard to diagnose if you have it or if you know somebody who does. And pain can be quite a chronic issue, debilitating problem. Yeah.
Yes, you just hit the nail on the head, Neha. So, what are the early signs of arthritis, or even how do I know if I have it?
Okay. So that's an excellent question. If you, and some of this, a lot of what rheumatology is, I'm a rheumatologist, and a lot of it, what it is actually, I would say, detective work, because we're not quite a field where we have a blood test for everything, or an easy answer, unfortunately, for everything. I would say my colleagues will sometimes explain it as the field of vagueness, because a lot of what we say and do is very vague,
Uh-huh.
because of the lack of very concrete measures. And to have something like arthritis, first of all, usually there's pain, right? And I want to take this and put it into two different compartments, because there could be something like you go to a doctor for a foot injury, right? Like you tripped off the curb and you want to get that checked out, and the doctor takes a picture and you say your knee hurts after you fell off the curb, and they're like, oh, you have all of these degenerative issues in your knee. What does that mean? Does that mean you have arthritis? That wasn't bothering you before this fall.
Yeah.
Well, actually, you would have degeneration at the joint, but you don't necessarily have active pain, right? Except for that injury.
Mm.
So technically, you would have arthritis because you have that degeneration, but it doesn't mean that it's going to affect you necessarily. And so, what I mean by um, trying to do detective work is if a 22-year-old will complain of pain, for example, in their hands, where they really have no business having pain at that age, and versus a 85-year-old who is complaining of pain in the hands, that's very different.
Mhm.
With the 85-year-old, I might be thinking, okay, this is the pattern in the hands that you're showing me, like over here at the base of the thumb, different areas that is more related to osteoarthritis, which is more of a degenerative arthritis as we get older. Now, if the 22-year-old is telling me the same thing, hey, doc, I have some pain over here, kind of at the ends and the middles, and over here in my knuckles. I'm starting to wonder if they have an inflammatory arthritis. So it's a different type of arthritis. So there's so many different kinds of arthritis. It's not just osteoarthritis. There's also rheumatoid arthritis, lupus related arthritis, gouty arthritis, like you've heard of maybe gout, right?
Mhm.
So, that also can give you an arthritis.
Mhm.
It's not just one simple type that we call blanket arthritis.
Mhm.
And I know sometimes when you go see somebody, they'll say to you, you have arthritis. But the question is, which one do you have? Because the treatment is going to be so different depending on that. So, yeah,
I'm
good
so
question.
glad. Yeah, I'm so glad you mentioned that. So it's good to know there are so many different types of arthritis, and which one do we have? So thank you for explaining, because not many of us know that, or not many doctors even let us know. And that was such a wonderful example. So what is the difference between osteoarthritis and rheumatoid arthritis?
So, osteoarthritis is the one that we kind of expect to get. If you are living to 100 years old, there is going to be degeneration at your joints. If you get an x ray of every joint in your body, they're not going to look the same as when you were 20 years old, right? Because now there's wear and tear in those areas. Maybe you have some bone spurs. Something is not quite as pristine as it used to be. Now, rheumatoid arthritis is more of an inflammation that your body is producing. So it's an inflammatory condition, an autoimmune condition. So your body is attacking itself, but kind of at the joint lines. That's the main area. But you have to be careful because when people think of the word rheumatoid arthritis, they're thinking of pain. They're thinking of pain in the joints, maybe in the fingers and the wrists and the elbows. But it's a systemic condition. And what I mean by that is it can affect the lungs, the heart, the skin. There's so many different areas. It can affect the voice box. These are all, you don't even think about this.
Yeah.
Sometimes people have hearing loss and it could be autoimmune hearing loss. Maybe it's connected to their rheumatic condition. You don't put those two things together, right? Your hearing and then your joint pain.
Mhm.
But a lot of it can be. So if you have an autoimmune condition, there's always that extra thought. This new symptom that I'm having, could it be related to my rheumatoid arthritis? Or if you have lupus, could it be related to my lupus?
Mhm.
Um, there is a condition, for example, called ankylosing spondylitis, which is inflammatory pain predominantly in the back. When people have that, they don't realize another, unfortunately, it's not even that uncommon, but another place they could have it is in their eyes. And
Mhm.
so when you try to say that, they're like, but I have an arthritis, why are you keep asking me about my eyes? And it can go there, right? It's a systemic condition. It can go anywhere, and there's definitely some spots that we think of more than others. I would say another common one is
Mhm.
psoriatic arthritis,
Mhm.
right? There's a fair amount of people out there have heard of a skin condition called psoriasis, right? And so psoriasis is this kind of thickened, scaly area, usually elbows, on your knees, but it can be in a lot of different places, scalp, lots of different places. But I would say about 30% of people who have psoriasis can get something called psoriatic arthritis, right? So
Mhm.
it's a different type of arthritis. It's not osteoarthritis. Now,
Mhm.
psoriatic arthritis is a systemic condition, and the medication to treat that would be these drugs that we use for autoimmune disease. So we're using very different treatments, depending on what the underlying type of arthritis is on it. So it's important to know. And I will say one thing, it is not easy always to tell, right? Because if you are, 69 years old and you happen to have skin psoriasis, but you
Mhm.
also happen to have pain in your hands, and then you're
Mhm.
like, but doc, what do I have? Do I have psoriatic arthritis or do I have psoriasis plus
Mhm.
osteoarthritis?
Mhm.
And there is no blood test, unfortunately, for psoriatic arthritis. There's nothing. We do
Mhm.
have blood tests for rheumatoid arthritis, but
Mhm.
not necessarily for psoriatic arthritis. So a lot of it is just pattern recognition. Does
Mhm.
this make sense in what you're saying and what I know to be a fact for psoriatic arthritis? Or is there anything on the X-ray or MRI that's pointing towards more of an inflammation rather than a degenerative condition?
So, how is arthritis diagnosed? I mean, so what tests are usually done to diagnose arthritis?
So for rheumatoid arthritis, a little bit easier for us because we actually have these antibodies that we can check, whether it's the rheumatoid factor or the CCP antibody, also known as citric citrullonated peptide antibody. It's a mouthful. But we do have those tests, and we take the inflammation markers, and we take the exam findings, and we kind of put it all together, and we say, okay, you have this. And I think we're right most of the time, right? Because we have at least some blood tests also to go on, right? So
Mhm,
it's not just our patterns. But
mhm,
now in other conditions, like maybe psoriatic arthritis, we don't quite have all the same. We don't have the blood tests. Yeah,
mhm,
you could have inflammation in your blood, right? Your inflammation levels could be higher, but those are non-specific. You could have had COVID and they'll be high. You could have
mhm,
had a sore throat and they'll be high. So we don't always know with those. But now if you have that, plus you have all the suggested areas of arthritis, and in psoriatic arthritis, you can also get a lot of tendonitis. So
mhm,
it's not just bones and joints, it's also tendons, ligaments, lots of different areas, which is why it's a little bit more challenging to make, especially in that small percentage of people that get psoriatic arthritis without getting psoriasis first, right? If somebody has psoriasis, it'll be in the mind of a rheumatologist that you could have that. But what if you didn't get the skin finding first? And,
mhm,
there's a lot of people that don't get it first. So
mhm,
you're right for those two. Now, something like gout,
mhm,
uric acid levels are often checked, by your primary care doctor. They can check uric acid levels. And if it's super sky high, that definitely can make a point for gout if you have those
mhm,
symptoms. But what if it's kind of borderline? You're not sure. That's where the rheumatologist kind of tends to weigh in. Or what we love to do as rheumatologists is to take fluid out of a joint, which you may say is kind of painful and not something you want to do. But of course, rheumatologists love to see all that, what you send to the lab, we love to see the results of that. So if we could just take fluid out of a joint, send it to a lab, and look to see if there's crystals in it, that definitely gives us a more definitive diagnosis of
mhm.
gout. Mhm. Or something called pseudo gout, which is actually fairly common, but we don't talk about it as much. And it
Uh-huh.
is a real type of gout, even though it's called pseudo gout. It's just a different type of crystal.
Okay, so looks like there are some like blood markers or inflammatory markers by which we can diagnose rheumatoid arthritis. So what about osteoarthritis? So how do we have any particular diagnostic test or?
No, I would
Mhm,
say blood
mhm,
marker wise for osteoarthritis, we don't really have anything. We don't expect the inflammation markers to be high for that.
mhm,
X-ray imaging, I would say, is a very common way to diagnose it, and
okay,
yet, it doesn't always kind of align with what you're thinking. And
mhm,
let's go back to that knee example I had said
mhm,
initially. Let's say you go to the doctor for left-sided knee pain, and
mhm,
they ask you, does your right also hurt? And you're like, occasionally, but not that often. And they say, okay, let's get x-rays of both of them. And
mhm,
they put up both the x-rays, and they point to both of them. And you said your left knee was feeling really bad, but your right knee has all that arthritis in it. It's not
uh-huh,
really your left side. So
uh-huh,
it's kind of like you had no idea all this time that you have all this degeneration. Now, should you treat it? No, there's no recommendations at this point that just based on an x-ray that you should go ahead and treat something. You
mhm,
just really treat the pain. But I wish that I could say there was a blood test.
uh-huh.
Unfortunately, not only is there not a blood test, but there is still not amazing medications for osteoarthritis. We wish there were more.
Mm. Yeah, that's interesting because lot of our participants, yeah, so they say like they have osteoarthritis, but it is really interesting to note. So when it comes to rheumatoid arthritis, yes, I mean, since it's related to inflammation, you're able to do something about it.
Yeah,
I mean, like
you're able
when
to.
you're taking care of inflammation, but osteoarthritis, it just seems like a gray area where I know, like as the degeneration is happening, but of course, like we will talk more about it. So, uh, can arthritis be cured, or will I have it for life?
So it's a good question. Like once somebody is told they have arthritis, I think it makes them very nervous that they will be in this state of pain
Yeah.
forever. And that's not true. There's definitely like waves, right? It could be worse during a certain time, and then it gets better and worse and better. Like it doesn't mean you'll have that same rate of pain. Is
Mhm.
it the joint that may bother you more frequently than not? Yeah, that's possible. And you kind of have to have your own tool belt, meaning that when it's this bad that you may need to take this medication, or you may need to do heat compresses or cold compresses because it's going to be bad. You
Mhm.
may choose to go for a hike, and you know that when you go for a hike, you feel good that day, but the next day you may pay for it.
Mhm.
It may be that the next day you might need to take medication for it, or stay off your leg that much. So, yeah, it's kind of controlling it that way, but I won't say that it will be the same rate of pain all throughout. Can it
Mhm.
be cured? I mean, if you have degeneration there, the degeneration's not going to go away, but you may not always have pain.
Mm. Yeah, that's so relieving to know. So are there any changes that I can make to reduce pain?
So there is, genetically, we actually don't have a huge amount of genetics that kind of translate into having a certain condition. For example, if your father had extensive osteoarthritis, pain doesn't mean that you necessarily will have it. So yes, genetics is one part of it, but it's not necessary. Can you do something for yourself? Well, I would say the first thing is movement. So most people do well with movement. And I know I was just seeing somebody who was in her late 60s, and she doesn't really move too much, meaning, she does daily life activities, but she doesn't necessarily go out for exercise or anything like that. And I was saying to her, I was like, it's as when you get older, right? We know after the age of 30, you're losing muscle, you're gaining fat, right?
Mhm.
And with that, you could be doing minor movements, but like reaching in the cupboard and you're
Mhm.
grabbing a can of sauce, and
Mhm.
now all of a sudden you have pain over here, right? So
Mhm.
you can get pain because your tendons and ligaments and all those supportive connective tissue areas are not quite as strong as they used to be. So
Mhm.
movement is number one in terms of trying to keep everything aligned and improved and in optimal shape. So exercising, I would say, is key.
Mhm.
The second thing is there was a study recently, it was a Russian study,
Mhm.
and they showed that with people complaining of pain, arthritis pain, some of the other components of it was having high amounts of depression and anxiety and just overall like muscular aches. So if you don't address other conditions like depression and anxiety, that really can translate more to pain overall. And you may feel like your arthritic pain is worse than it actually is because of these other like co-conditions, I would say. There's also, and both of us are more interested, I know, in lifestyle medicine. And there's more and more studies coming out on food and the impact of food on your lifestyle, including your pain. So
Mhm.
there has been studies that are showing that certain foods, like high sugar foods specifically, they definitely can trigger pain in people. And I hear all the time, like I would say the most common thing that I hear if I start talking about food
Mhm.
and inflammation and pain is when people say, yeah, I was feeling good and then I fell off the wagon. And I'll ask them, I was like, well, what for you, what is falling off the wagon? What did you do? And they'll say, well, I went on vacation, and there was all these pastries and I was just having a good time. And that's fine to have a good time, but like sometimes your body is paying for it and you don't feel so well afterwards. Um, One of my students, he has lost 100 pounds, which
Mhm.
is amazing, right? To just
Wow.
it's a
Yeah.
lot, right?
Mhm.
So and the other students were so excited about this, and they were like, well, do you notice a change in how you feel? And he
Uh-huh.
was thinking about it. He said, well, when I go on vacation, I kind of go all out. I'm like, forget about my weight loss and watching what I eat and all that. Let me just go all out. I have a good time.
Uh-huh.
And then when he comes back and he's flying home, usually from
Mhm.
his vacations, he's
Mhm.
like, I don't feel as good as I used to. I'm just not as like on point, even mental wise. I'm
Uh-huh.
just overall sluggish. And he's like, yeah, all that food, it does impact you. And this
Mhm.
is from somebody who can see the difference because he's so conscious now of
Mhm.
all that weight that he lost and like how it impacts him. But I would say food is a big one.
Mhm.
We're seeing more studies coming out on different foods that can be helpful, like turmeric, for
Mhm.
osteoarthritis.
Mhm.
And I want to say that there is studies also for turmeric and other types of arthritis, but
Mhm.
I'll say the most robust ones are really for osteoarthritis. And I know we've done a study over here with
Mhm.
our patients and
Mhm.
with rheumatoid arthritis and psoriatic arthritis, and those people felt better. Up to almost 50% of people felt better when they were taking turmeric.
Mhm.
But at the same time, they felt better, but we don't know that it was really impacting the inflammation. So
Mm.
what we wonder is if it's the osteoarthritis that's doing better and not necessarily the inflammatory arthritis.
Mhm. Excellent. So we'll definitely talk more about the diet or how diet affects arthritis before we go into that, because I know that's a favorite topic for both of us. What are the best exercises for managing arthritic pain?
So it kind of, as a rheumatologist, I love anything that strengthens the bone, right? Because I'm
Mhm.
always concerned of people's bone loss as they get older. So those would be more weight-bearing exercises.
Mhm.
But I would say that for people that cannot do weight-bearing exercise, and they're hard to do, right? So if you have chronic low back pain,
Mhm.
chronic muscular pain, it's sometimes hard to do strength training or other exercises that we want you to do. So I would say the best place to start is really the pool. I love aqua aerobics classes. I think they're the
Mhm.
best. Buying a $1 pool noodle, for example, all you really need is that $1 pool noodle, a pool, and a YouTube video in front of you. Okay. And you can get a lot out of that. You don't have to necessarily pay for expensive classes. It's
Mhm.
just, I like classes because I think it's fun to do it with
Yes.
friends, kind of, it's more energizing when you
Mhm.
know people, but you don't need it. I mean, it doesn't have to be a very expensive feat at all.
Mhm. That's so good to know. Yeah, thanks for offering that tip. So coming back to diet, you did give a glimpse like how diet can affect arthritis, but are there specific foods that help with arthritis?
Mhm. So so we talked about supplement
Like,
like turmeric. I
mm-hmm.
would say ginger is actually one of the more common foods that have been shown to help the pain related to arthritis,
Hmm.
and whether it is, shredded ginger or ginger in your smoothie or whatnot. I mean, there's so many different forms you can use of it, or even ginger powder.
Hmm.
That itself is really, something that's been helpful. Just recently, my grandfather-in-law, he passed away, but he was 102 years old. And so
Wow.
I was trying to figure out what are the consistent parts of his routine
Uh-huh.
that has taken us all this way to 102. And aside from exercise and movement,
Hmm.
every morning for the last 80 plus years, he
Hmm.
puts ginger in his milk. He has a glass of milk every morning
Uh-huh.
with a teaspoon of ginger powder. And
Hmm.
I mean, all I can say is we've seen that there are studies showing the anti-inflammatory effects of it. And
Hmm.
he was living proof at 102 and still walking everywhere and miles a day. So yeah,
Wow.
ginger's
Wow.
another big one.
Yes. So movement, I mean, we don't realize it, but so that is such an inspiring story of your grandfather's, like, because we don't get to hear like how, like, movement,
Hmm.
and it's really amazing because further down our generations, the younger generations, what I find is the physical activity is coming down and down. So the amount of physical activity that we used to have, I don't see our kids having that, or I
Yeah.
wouldn't see our grandkids having that much amount of activity.
Well,
So,
I think it's being more promoted now in school. So
mhm.
I think that's helpful. My kids sometimes talk about yoga in their gym class, and I'm like, oh, okay, that's great. I don't know what kind of yoga you're learning, but I'm glad you know what the term is,
Yes.
and that there is something that's inspiring you there that's interesting. Because really, we have to make exercise fun also, right, for that next
Yes. Yeah.
generation. And
Yeah.
it's different. I think when we were younger, it wasn't a consideration it's too hot outside. Like that was,
Yeah.
you still go outside for gym class.
Yes.
But now it's like if it's too hot, they'll keep you inside. But then you're like, when are the kids getting movement, right? And they're sitting in their
Yeah.
classes all day.
Yeah.
So I agree with you. It is a bit of a different generation. But I think another big thing that has changed is the sedentary lifestyle. I mean,
Mm-hmm.
we're just different. You are expected to sit at your desk,
Hmm.
and it's really challenging. And imagine you have arthritis, like a even inflammatory arthritis,
Hmm.
especially like a rheumatoid arthritis, and you're sitting at your desk for 10 hours a day. Now,
Mhm.
those type of arthritic diseases, whether it's rheumatoid arthritis or psoriatic arthritis or some autoimmune, they do better with movement. So
Mhm.
if you don't get up every hour to stretch out those bones and joints, you're going to generally not feel as good. So
Mhm.
we also, I think the way the work has changed over time has really impacted how we feel.
Yeah.
Yeah, I mean, sitting still for anybody, for you or me or anybody
Mhm.
else, 10
Mhm.
hours a day, I just
Yeah.
don't see how it's benefiting people in terms of their movement.
Mhm. Yeah. Yeah. Thank you for mentioning that because that is so important. Um, So when it comes to osteoarthritis or degeneration, I mean, is there something we can do to, reduce the progression of degeneration of our joints, or is there something that we can do to better take care of our joints?
So aside from movement, I
Mm-hmm.
mean, exercise is number one. I would
Mm-hmm.
say
Mm-hmm.
watching our food intake in terms of processed foods,
Mm-hmm.
is a big one. Sugar, processed foods in general, which we're seeing everywhere. I know we haven't touched on that yet,
Yeah.
but I do think that's the second most important thing. The third thing is in terms of, for example, smoking, right? Like we know that it's not good for us cardiac wise. We know that it's not good for our heart. It's not good
Mm-hmm.
for our lungs.
Mm-hmm.
But not many people know that it also triggers autoimmune diseases, right?
Mm-hmm.
Like, so smoking itself, you may never, there be nobody in your family that has an autoimmune disease. And you're wondering, why did I get this? And you have to kind of look back at risk factors. And something like smoking, it's almost one out of every about five smokers could have avoided rheumatoid arthritis if they didn't smoke. So
Mm-hmm.
certainly that's something that we don't talk about much with arthritis, but smoking is another one that can really be problematic. Yeah.
No, uh, that is so interesting to know. You're right. You wouldn't associate smoking with the arthritis, while
Yeah.
we associate that with heart disease. Yeah. So, uh, can you, can we just explore a little bit on the diet? Because I know you mentioned like sugar is one thing that can actually affect arthritis, but when it comes to diet, are there anything else that we need to pay attention? So you mentioned about the processed food.
Mhm.
So when it comes to diet, because not many doctors talk about it to their patients. So they said, yes, eat healthy, eat good. But like when it
Mhm.
comes to arthritis, are there particular foods that affect or are there particular foods that we can take to avoid inflammation and arthritis?
So there, aside from ginger and turmeric, there
Mhm.
is some pineapple is a lot. I hear a lot about pineapple. Should I eat pineapple or not?
Mhm.
And there really, I think it's helpful. Like I don't know why people are asking me recently. I was told not to eat it. I'm not sure about why, but I think bromelain. They're helpful overall.
Mhm.
And in terms of like if we go back to processed foods, for example, it's not necessarily the food itself that's the problem, right? But it is, we're hearing it. I'm sure you've heard this before, that when you eat a certain food here, right, it tends to aggravate you, maybe cause stomach symptoms,
Mhm.
bloating, just not feeling well. And
Mhm.
yet you can eat the same food in Europe, for example, and
Mhm.
you're not necessarily getting all those same symptoms. I hear it actually, I've heard it many times amongst my patients, my friends, especially with something like bread.
Mhm.
Not everybody has celiac disease. It's not that common, that people cannot take celiac or gluten. They can't take gluten. And
Mhm.
yet, a lot of people can't seem to handle it here. So when you talk about processing, it's not just the food itself. Like, it's not just that, it's what they're putting in the food. So if you
Mhm.
take back like 100 years ago, when people made bread, they
Mhm.
fermented it, right? They had this
Mhm.
process 12 to 18 hours overnight. You have this nice fermented bread.
Mhm.
And now the problem we're seeing is like the Wonder Bread generation, right? It's
Mhm.
in one side, out the other. There is no fermentation here. You're
Yeah.
getting this instant, ready made
Mhm.
thing that is probably saving a lot of money, or making a lot of money for somebody, but it's not
Mhm.
necessarily good for your health. And
Mhm.
so if we look at foods that could be helpful, for us overall, we're
Mhm.
looking at foods like fermented foods,
Mhm.
I know that you've probably talked about before with kombucha and miso and all these kind of different fermented foods.
Mhm.
However, we're not really eating that in our society. Like, as a part of the Western diet,
Mhm.
that is not there.
Yeah,
That's
that
just.
is so true, Neha. I mean, like I come from an Indian culture, and it is part and parcel. Fermented foods, they are
Mhm.
part and parcel of our daily. So, like even like we ferment lentils and have them for breakfast, and
Mhm.
it's such a staple food. And like our every meal ends with a fermented food. So it's really interesting that you mentioned. Yep. Hmm.
Yeah, I mean, like natural probiotics, right? Like
Hmm.
buttermilk is a big part of like my culture.
Hmm.
Talking about longevity,
Hmm.
my great grandmother, we would go all the time to visit her, and my dad would say, "This is it. This is the last time you're going to see her." When she was in her 90s, and we would go, and we'd go all the time. We'd take the big video camera out. It was a giant back then, and we'd go, and she'd still be alive. So the following year we'd go again, and so she lived actually till 108. So I got to see her for many years. And the one thing that I can remember is her kind of like, hitting the wall and just like yelling out loud. She's like, she wanted her buttermilk. Like that was very important to her. She had to have her buttermilk several times a day, and she loved it. And that's actually, a natural probiotic, right? The
Uh-huh.
buttermilk that, you eat all the time. I mean, there's so many different forms of it, between like even like, different cheeses. If you eat cheese, for example, there are the aged cheeses that are probably better to eat than the fresh ones. Kimchi, pickles, sauerkraut. There's
Mhm.
so much. Tempeh, tempeh is not,
Mhm.
I know, as popular as tofu, but it's still a
Mhm.
very good food, and it's good
Yeah.
for you. Now, a
Mhm.
lot of people will say with yogurt, can I frozen yogurt, my froyo does that count? I will say that does not count.
Yeah. So that's so good. So like looking at diet, definitely like we are able to see, but are there certain vegetables or anything that let's say if people find when they're eating a certain vegetable that it is causing them more pain? So um is
Are you like
there
saying like the nightshade vegetables?
yes, yeah.
Yeah,
Mm-hmm.
so the nightshade vegetables, which are like eggplant and
Mm-hmm.
tomatoes, white potatoes, peppers, they have this compound in them, solanine, which does bother some people. So
Mm-hmm.
I'm not going to say it bothers everybody, but
Mm-hmm.
it is something that, and it may not be that all of those vegetables bother you. It
Mm-hmm.
could be something that, peppers bother you, for example, but maybe tomatoes don't, or maybe cooked tomatoes bother you, like in a pizza sauce or a spaghetti sauce, but
Mm-hmm.
eating it on a salad doesn't bother you. So it
Mm-hmm.
does matter kind of what the vegetable is. Don't
Mm-hmm.
cut them out because they are actually very good for you, those vegetables. But it may be that something in that group is triggering your pain. And so
Mm-hmm.
what I generally recommend is to have a food journal, right? If you are, in your youth and you have no pain, you don't have to think about these things necessarily.
Mm-hmm.
But as we get older, there are things that we become more sensitive to. We're not
Mm-hmm.
necessarily allergic to them, but our body seems to be sensitive to them. And everybody's different. So
Mm-hmm.
it's not necessary to get like, this list from somebody
Mm-hmm.
to say, cut out all these things because they may not all impact you. Yeah, you
Mm-hmm.
could cut them out, but then bring them back into your diet if they're not bothering you. Like,
Mm-hmm.
why get rid of them when they have such healthy characteristics behind them?
Yeah.
And then, like, there's been a lot of studying about the Mediterranean diet.
Mm-hmm.
And even in my world with autoimmune disease, like rheumatoid arthritis, for example, there was a study, that they had the Mediterranean diet, that they saw people did better with it. They had less pain in it. And one of
Mm-hmm.
the components that they saw was when they took monounsaturated fatty acids, so taking more of that may help more with pain. And
Mm-hmm.
so, like, kind of examples of that are like nuts and
Yeah.
avocado,
Mm-hmm.
olive oil. These are all examples of monounsaturated fatty acids, which can be helpful also for diet.
Mm-hmm. Mm-hmm. Yes. Thank you so much, Neha. So, just like food, can stress or lack of sleep affect arthritis or make it worse?
Yeah, so absolutely. So stress can aggravate everything. We
Mm-hmm.
see that often in the autoimmune disease world as well, where
Mm-hmm.
people are doing perfectly fine, and then,
Mm-hmm.
a life event can really kind of put them back. They go back into having flares all the time of their arthritis, and it's all been set off by some really stressful time in their life. There was a recent study, though, that they had actually tested between a major life stress event versus having kind of more of a daily stressor, whether it's a job that's really tough. And
Mm-hmm.
I think I always assumed that the life stressor was worse, but
Mm.
actually in their study they showed that having this daily stress that you face every single day, day in, day out, was worse for having flares of the condition than would be a life event, which most people were able to kind of bounce back from eventually.
I'm so glad you mentioned that, Neha, because I see and hear this a lot of time, and they say because of the daily pressures, because there were a lot of people who complained about the pain, and when they left the job, they were surprised that there was no pain.
Yeah,
So
it's amazing,
it
right?
was, yeah, so it was so amazing. We don't think of that, but like it's amazing how stress can affect and like bring pain. Amazing, yeah.
So
So how
actually, like to that, I would say I don't tell my patients you should go ahead and get a divorce because I certainly don't want to get involved in people's, married life. However, I have definitely seen people improve their disease activity, their arthritis pain after a divorce, right? Like because, that was really stressful for them, and maybe they were
yeah.
married to the wrong person, and
Uh-huh.
now that stress is gone. You're right, like they feel so
Mhm.
much better. So
Yeah.
yeah, it is something we don't pay as much attention to as we should.
Hmm.
Same way toxic jobs, like being
Hmm.
in a place where you hate to be
Yeah.
definitely doesn't make anybody feel good.
Uh-huh. Absolutely. What about sleep, Neha?
So sleep has definitely been shown, to really aggravate any kind of joint symptoms. If
Hmm.
you deprive people of sleep, they
Hmm.
will have pain. I mean, you can only do it for so long before they have it. There was a med student study actually deprived all these med students of sleep. And they eventually all had this myofascial type pain, like what we call like fibromyalgia,
Uh-huh.
which is basically what it is when you're not sleeping well, you're not recovering,
Hmm.
and all of that will kind of play into the feedback mechanism for pain in your body and say to your body that you have pain all the time when you may not have it, but this is all from dysregulation, from this lack of sleep. So absolutely sleep impacts it. Yeah.
Yeah. So, Neha, we do have some participants who have fibromyalgia. Would you be able to talk a little bit about, and our audience would really love, because this is one thing that most of the people endure.
Hmm.
So, just wondering, yeah.
Sure, sure. Yeah, I can
Mm-hmm.
talk about it. Yes, fibromyalgia is more common, I think, than we realize. And we see it a lot in a rheumatology clinic because once you have, and it's not just rheumatic conditions, once you have pain, right? Pain begets more pain. So you end up in this constant state of pain. It's not just in your joints anymore. Now you're having it in your muscles and you're just not
Mm-hmm.
overall feeling well. Now, you don't have to have another disease with it. You can have just fibromyalgia by itself. But if you have it, I think some of the key components to look at are anxiety. How much anxiety do you have? Is it being treated? How much depression do you have? Because the depression really plays into it, along with the sleep. So it's rare to find somebody who has fibromyalgia who doesn't have poor sleep and doesn't have some aspect of either depression or anxiety, because they all tend to play into each other, and it's hard to feel well until all of that is controlled. Now,
Mm-hmm.
have has somebody with fibromyalgia, have they been worked up for sleep apnea, for example, right? Because if they have sleep apnea, and don't just assume it's related to weight, there are people who are on the thinner side who have sleep apnea, and I think they often get overlooked
Mm-hmm.
because their weight is less, and so people don't think about it. But
Mm-hmm.
it absolutely can play into that poor sleep, because then even if you're sleeping 8 hours or 9 hours a night, but you're not getting good sleep,
Mm-hmm.
you're not getting the restorative sleep, then you're not going to feel well.
Mm-hmm.
Absolutely, there are medications. There are medications, whether you're taking Cymbalta or Lyrica, Savella, gabapentin. There are a lot of different medications. I won't say they're wonderful medications. You don't when you look at fibromyalgia and how
Mm-hmm.
people feel even after taking medications, it doesn't seem like they feel remarkably better. Like
Yeah.
when I give somebody a biologic medication for rheumatoid arthritis,
Mm-hmm.
they can go into remission. I will say for fibromyalgia, it's not really the same. It's hard to find people who are going into remission, meaning they're feeling almost normal again.
Mm-hmm.
Usually with fibromyalgia, we're just hoping people get better,
Mm-hmm.
and it's a question of how much better can we make them, and part of that is so many different aspects, right? I would say the psychological aspect is a lot of it. A
Mm.
lot of times I'm finding, and this is where it's really tough, right? Because in your few minutes that you get an appointment, I don't know how it is in Canada. I know in
It's the
America,
same. It's the
the
same.
same, right? Yeah, you
Yeah.
don't get much time to talk to
Yeah.
people. But
Mm.
there's so many people I've been seeing over years and years,
Mm.
and one day it comes out, that there was an inciting event. There was some event in the past, in their history, that
Mm.
either nags at them, bothers them, or actively, even whether it passively bothered them before or actively bothers them now, it's kind of eating away at them. And
Mm.
a lot of time, like trying to cope with that and seeing somebody for that is really what helps, because now you can try to get to the bottom of the story instead of kind of trying to cover it up all the time.
Mm.
So in fibromyalgia, I will say it's not just medication. I think that is one component if you go down that route, but it's
Mm.
also, seeing somebody or coming to terms with whatever other issues are going on with the
Mm.
depression, the anxiety, the sleep part of it. But then there's movement. You
Mm.
have to do movement with fibromyalgia. And the problem is people don't feel well when they start anything. It can
Yeah.
take about 4 to 6 weeks when you start a new exercise regimen of any sort to feel
Uh-huh.
good. It's going to hurt in the beginning. And
Uh-huh.
nobody wants to continue it when it hurts. But the
Yes.
problem is you have to do it by gradation. You have to go gradually. You've got to increase because otherwise it's a tough condition to beat.
And I find, like, especially people with fibromyalgia, when you ask them to increase the movement, they complain of pain and they, I mean, they're so afraid. Even a
Yeah.
simple walk, they say, like, my legs are hurting. Actually, they swell. I mean, and they show me, see, I mean, just because you wanted me to walk, see, like, I get all the swellings and it's hurting. So, like, even encouraging them to do little movement has been
Mhm.
so hard.
Yeah, it is hard, and it's a part of it. Like I don't see people getting better unless they move. Like
Mm.
that is definitely a part of it. That's why I prefer aqua exercises to begin with, because
Okay.
those are non-weight bearing. I would say fibromyalgia for sure as one of the first treatments to do. And you don't have to necessarily, you're not swimming in there. You're doing aqua aerobics doesn't mean you're swimming. So I think that's a fear for a lot of people. Find a shallow pool. Make
Mhm.
sure you're not alone in that pool if you can't swim. But
Mhm.
you don't have to swim. Part of it is doing the exercises. Walking backwards in a pool, something as easy as that, you're using different muscles than you
Mhm.
use when you walk forward, right?
Mhm.
And you have to use all the different muscles in order to improve and to build up strength, right?
Mhm.
Strength training is a big part, I think, of all of this. You can't start necessarily there if you can't handle even in pool like aqua training, because that's non-weight bearing.
Mhm. No,
So
thank
yeah,
you
but
so
I
much.
actually, so I know you shared my
Uh-huh.
YouTube channel, right?
Mhm.
So on the YouTube channel is a whole video actually on fibromyalgia and non-drug treatments.
Mhm.
So because the fact that I know there's drugs out there and
Mhm.
probably people have been offered those drugs, but really
Mhm.
what I want to talk about is the non-drug treatment. So yes,
Yeah.
absolutely, you could look at that.
Yeah. Yeah, and that is so useful and beneficial because a lot of the fibromyalgic patients, what they say, so they take a lot of anti-anxiety drugs, and they say even to fall asleep, I mean, they take a pill every day so that they can just fall asleep.
Yeah.
So
And if
it's
that's all it is, like if that one pill is causing you to or is helping you to sleep so that you have less pain the next day, so that you can move and do your exercise, it may be worth it. Right? So
mm,
I don't look at it as, you have fibromyalgia and you're feeling good, but you're on medication for it. No, don't look at it like that. You're
yeah.
looking at it as in you're taking the most minimal amount of medication that you
Mm-hmm.
can get away with that's
Mm-hmm.
helping you kind of live a better life.
Mm-hmm.
That's what your focus should be.
Mm-hmm. Excellent, excellent. So, when it comes to joint health, we hear so much about supplements or vitamins, and a lot of our participants they ask me, okay, should I be taking supplements for my joint health? Because I hear this, okay, should I be taking collagen or should I be taking? So, what's your take on, or are there any supplements or vitamins I should be taking for my joint health?
Mhm. So I would say like one of the more common ones are glucosamine and chondroitin sulfate, right? Like so you hear
Mhm.
about that all the time.
Mhm.
And some years the research studies are positive and that they're helpful. And some
Mhm.
years the research studies are like, no, they don't really help. So
Mhm.
I would say it's kind of 50-50 on that. there's not that much harm in it. But Shobha, who makes these? Like, where do you get all the components of this medication or this supplement? It's
Uh-huh.
actually cartilage, right? From
Mhm.
animal derived cartilage. Now,
Mhm.
is the butcher, are they really worried about quality control? I don't think so, right? That's not primary on their
Mhm.
focus when
Mhm.
they're, being a butcher. So, and
Mhm.
that's where you're getting the animal cartilage from. So if you look at the supplements, there's no regulation to them. There
Mhm.
was a study where like the prescription grade supplements of
Mhm.
chondroitin sulfate, glucosamine and chondroitin sulfate in Europe were
Mhm.
shown to be a little bit more successful than the over-the-counter ones in America. But
Mhm.
overall, the ones that we get here over the counter, they're not regulated. We don't really know what's in them. If you take them and they're
Mhm.
helping you, go for
Mhm.
it.
Mhm.
I don't think there is so much harm in them.
Mhm.
But there is no regulation. So in the end, we don't actually know what's in them. The FDA is not regulating it.
Mhm.
As we've seen, do you remember like years back, there was this expose. It
Mhm.
was on Vitamin Store. It was a GNC
Mhm.
actually.
Mhm.
And there they found that what they were saying they were selling in those supplements was not really what they were selling.
Yeah.
So there was none of that actually to be found in those supplements. So
Uh-huh.
when you take something, I think it's really important to know what you're taking.
Mhm.
Turmeric, even, which is a very common supplement nowadays, you have to make sure it's kind of the real thing.
Mhm.
When my mom, when she would buy me turmeric, she would
Mhm.
go to only specific places because she wanted to make sure it was not cut with lead or anything
Mhm.
like that. People even take like all-purpose flour, like white flour, and they
Mhm.
dye it yellow and they call it turmeric powder, right? So it's
Oh my
it's
God.
crazy all the like stuff that people do out there. So you have to make
Uh-huh.
sure you're getting the real stuff. So
Uh-huh.
generally, when I tell people if they
Mhm.
want to do supplementation, and I
Mhm.
think with turmeric especially, it's a little important because
Mhm.
you can get it from Costco, you can get it from Whole Foods,
Mhm.
or like more reputed places because
Mhm.
you'd want to know what you're getting in there. And
Mhm.
you should get it with the black pepper part for the
Mhm.
absorption. And if
Yeah.
you're getting on Amazon, that's fine too, but you want to go with the one with like 5,000 reviews, not like two reviews, because you don't really know what's in that. So I think that's important. So as a
Mhm.
supplement, the
Mhm.
other thing is the collagen, there really isn't much data as to
Okay.
whether it's helping
Mhm.
that much. I mean, we need like robust trials, which we don't have.
Mhm.
On the other hand, it doesn't look like it's really harming anything. So if it's something that is suitable to you, then that's fine. I will
Mhm.
say though that there have been arthritis supplements out there
Mhm.
that have, I would say, secret ingredients in them that we don't really know about. Like
Mhm.
some of them have steroids in them and they don't write it
Mhm.
on the packaging, until somebody actually analyzes them, they don't realize that's what's in the supplement. So if
Yeah.
you're kind of gaining weight and you're like,
Mhm.
this has all happened after the supplement, I would really take a look at that and see what
Mhm.
exactly is in there because we
Mhm.
really don't know with that
Okay.
lack of regulation. Mhm.
Mhm. Oh, thank you so much, Neha. One participant is asking, what about taking lutein? So
The
does
lutein, there isn't really much data on that, I would say. I
okay,
mean, if it's helping any of these supplements, I would say if it's helping, I wouldn't try for more than 2 months. Okay, because
okay,
these are expensive supplements. We
yeah.
don't really have great data on them. If you try it
Uh-huh.
for 2 months and it's helping you,
Mhm.
then okay, maybe you can continue it, if
Mhm.
that's something that works for you. But after that, why spend the money if it's not doing
Mhm.
it? It should help by then, for the most part, most of
And
the
even
supplements.
for a lot of people, instead of taking when they have symptoms, they are taking thinking that it's going to prevent them. So mostly they are taking in terms of preventative aspects. But as you said, there's not much
There's
regulation.
not much, no. But
Yeah.
then if you take something like ginger, for example, ginger
Mm-hmm.
is not meant to be like an ibuprofen where you
Mm-hmm.
take it only when you have the pain.
Mm-hmm.
Something like that, if you tend to have more arthritic pain, it's more of a constant. You're taking it daily, and then it may lower overall the amount of pain, but it's
Mm-hmm.
not going to be as potent as taking an Advil or Aleve or some form of ibuprofen. So
Mm-hmm.
yeah, so a lot of these supplements, they're helpful, but they're to a degree they're helpful.
Okay. 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 That's really helpful, Neha. So I know So what I'm hearing, just to summarize, so when it comes to, yes, I mean, diet does affect arthritis, affects inflammation. So we do have inflammatory arthritis, for example, rheumatoid arthritis. At the same time, we also have degenerative arthritis like osteoarthritis. So when it comes to inflammatory arthritis, certainly like when we pay attention to food or take food that reduces our inflammation, it really helps us. So like you mentioned about turmeric, you mentioned about ginger, and you mentioned about like taking fermented foods,
Mhm.
and and also like when you're thinking about soy, so having tempeh or probiotics. So
Yeah.
these are all like excellent things. I mean, these are all the simple strategies that we can incorporate in our daily
And I
life.
know we didn't really talk much on probiotics, right?
Yes.
But actually, there was recently an interesting study on gout. So if somebody has gouty arthritis,
Hmm.
on a specific probiotic, and they did a head-to-head with actually our more common medication, allopurinol, and they
Okay.
saw it was a similar effect. So I think there are more studies coming out on probiotics.
Uh-huh.
But right now, again, we don't know what's in that probiotic that they're actually selling in the store. So I
Hmm.
think we need way more research on it, but there is so much with the gut microbiome
Hmm.
and kind of this interplay with what we're eating and what is happening to our bodies because of that. So
Yeah.
yeah, I think there's just so much more to that. Hmm.
And I'm glad you raised this point because even not many people are aware. So just because of gut dysbiosis,
Hmm.
that like we don't put that together, okay, because of gut dysbiosis I got arthritis, but like it is so common. So when we have that imbalance, and also like when it comes to yes, I mean, you're mentioning about probiotics, but what people don't realize, like when they're eating those vegetables and beans, they're technically acting as prebiotics that can be converted into probiotics. So yeah.
Absolutely, yeah,
Yeah.
yeah. So there is so much to the gut dysbiosis, yeah, that we are just at literally the tip, I think, of it. And my field is finally entering the foray as well and doing research on it. I know the gut people are way ahead of us, the GI folks, but the rheumatologists are trying to get in there too. And also now a lot of our conditions, whether it's lupus or rheumatoid arthritis or osteoarthritis, there
Mhm.
is so much more coming out now on the foods, right? We keep talking about the foods, but you're right. It's the interplay with the foods in our gut and what's
Yes.
happening after that that really is
Mhm.
what we need to know about.
Excellent, excellent. So, could you briefly touch upon lupus? I know, like again, it's another big topic, and we definitely need another session talking about it. But could you briefly talk about, so like if somebody has lupus, so in terms of in the beginning you did mention like how to differentiate the symptoms between osteoarthritis and rheumatoid arthritis, but where does this lupus fall under?
So it's its own connective tissue disease. It's neither rheumatoid or osteo. It's its own separate category. You know,
Mm-hmm.
um, I know there's so many famous people who have it. Between Selena Gomez and Seal, and there's a lot of people.
Mm-hmm.
But it's hard because when you look at the symptoms, if you Google lupus,
Mm-hmm.
like all the symptoms that are popping up can really be symptoms of other things as well. So it
Mm-hmm.
really takes, I would say, a discerning rheumatologist. Like the rheumatologist really has to figure out if somebody has lupus or not. I mean, sometimes you can manifest in the kidney, and yes, the kidney specialist can see you and say, "Oh, this is what you have."
Mm-hmm.
But it's not just the symptoms; it's the blood tests. We do have blood markers that go along with that,
Mm-hmm.
and so between the blood tests, the pattern of pain or the rashes or the
Mm-hmm.
other symptoms,
Mm-hmm.
that all can be put together into this totally different type of arthritis. So
Mm-hmm.
yes, when we talk about arthritis, we don't often think of lupus, but it
Mm-hmm.
has its own arthritis that's associated. And I know we've been talking a lot about food. I
Yes.
would say lupus, it was a really interesting study recently from Harvard, actually. And I think it's important for anybody that's worried about getting lupus. So,
Uh-huh.
what they found was that they had people who had this very specific blood marker. It's called the double stranded DNA antibody. So,
Mm-hmm.
women who had that, who ate a lot of ultra processed food, they had a 50% higher chance of getting lupus, which I
Mm-hmm.
think blow your mind. that's saying quite a lot there. So I
Yeah.
think it'd be nice to see bigger studies, to
Mhm.
see what they're finding, but to realize that food is that associated with developing an autoimmune condition. I mean, there just needs to be so much more research done behind that.
Yeah, yeah. Thank you so much, Neha. I didn't know where the time flew. So, and I know you have to get back home to your children as well. So I greatly appreciate and thank you so much for your time. And like we have wonderful comments here thanking you.
Thank you. Thank you for
Yeah,
having me. I really appreciate it. And always happy to talk about autoimmune diseases and arthritis.
yes,
And
we will
yeah,
definitely have another session on autoimmune and lupus because I know it's a big topic. So like our community would love to hear that from you. So
sure, of
yeah.
course.
So thank you
But yeah,
so much,
no
Neha.
problem. You guys can find me on YouTube at Neha Bhanusali.
Yes.
And yeah, always happy to